Every day, 10,000 baby boomers are turning age 65. And we know that this population, just like the pediatric population has special needs, our seniors have special medical, social, and other needs that we can really address in a unit like this. Earlier this year, we opened the Gary and Mary West Senior Emergency Care Unit for patients over the age of 65 who have a positive ISAR score, which is the identification of seniors at risk. Those patients will be placed into our specialized area here. We can see that this area is different than our current emergency department space. This area is specially designed for our seniors so that it's a comfortable environment for them to actually get their prolonged stay in the emergency department and get their care during that time period. There are several architectural elements that will make it senior friendly. So for example, there are non-slip floors, there is lighting that's circadian friendly so that patients will have decreased interruptions with light and sound. Much of the rooms and the area is designed to be very quiet so that sound does not interrupt patients while they're resting and recuperating here. There's also artwork by Aaron Cheng throughout the space that helps orient people to the fact that they're in La Jolla, in San Diego, and helps decrease agitation and uncertainty. There's also technological enhancements within each room which keeps patients and their families up to date on the care that they're receiving and the expected treatment plan. We have a nursing team that's very well versed and trained in advanced geriatric care. Specifically, we have a group of GENIE nurses, or Geriatric Emergency Nurse Initiative experts, that are focused on advanced geriatric care screenings and have the clinical decision support tools to actually bring other resources to the patient in the emergency department.
So the first exam we do in triage is called the ISAR. ISAR stands for Identification of Seniors at Risk. This has 6 questions that are a good indicator of whether the patient, the senior, is going to have a poor outcome if we discharge them from the ER today. Such questions as, do they take more than 3 different medications a day? Have they been hospitalized for 1 or more nights during the past 6 months, excluding a stay in the emergency department, but an actual stay in the hospital? Or in general, do they have any serious problems with their memory? It also talks about care prior to coming to the emergency department, and if they are, do they need care prior to coming to the emergency department? And do they think they'll need more care now that they're in the emergency department? So it's a very good indicator of a risk if they are discharged from the emergency department.
Our goal in the Senior Emergency Care Unit is to improve transitions of care and to hopefully decrease hospital admissions so that we can give patients what they desire, and that's usually to get home and to get to a more comfortable environment. The research that we're doing is looking at all of these screening tools, looking at innovative models of care, and not only improve the care for our community here in San Diego, but also demonstrate how excellent senior care can be achieved in the emergency department to health systems throughout San Diego, California, nationally, and even internationally, where we can really be the beacon for excellent emergency care for seniors.